and ultimately this result in the increase in mortality of the COVID-19. So most of the end-stage liver disease patients died because of COVID-19, might be unnoticed at home or because of their severe decompensations. So what we, after the first lockdown, we adopted to do a COVID PCR of both recipient and donor 24 hours prior to transplant. And in case of a symptomatic pair, which we had to go for a HRCT, high resolution CT scan. If both are clear, then we advise for a transplant, and we did our first transplant in September 2020 after the first lockdown. So since then we have been striving. We got a lot of patients, we got a lot of recipients, especially donors, because they are a normal human being actually. So they got a COVID infection negative. So we delisted for a time period till the resolution of their disease. So more than 1,500 patients we have seen for the last 2 years, nearly 2 years, with the liver disease and tumor of various stages. Most of them were lost to follow-up again, and they're not interested in transplant and disqualified because of their poor physical status, advanced tumor stage, serious comorbidities, and non-availability of the donor. So in last 2 years, we listed 93 patients of a liver transplant, and we did only 51 transplant. The rest of the 42, that is 45.16%, were delisted because of their donor issues, because they didn't have a donor, suitable donor for a transplant, although they were willing for a transplant, but they didn't have a donor. Due to financial constraints, as the COVID-19 impacted a lot of the economical aspect of people, so they have they even didn't have money to do their preliminary or basic workup. They didn't have money for their post-operative follow-ups as well. And waiting list mortality, which were encountered in 8 patients due to COVID-19 related issues and serious decompensations. However, we did a 52 transplant so far in the last 2 years, despite having this pandemic. So total number of transplant, which is 52, in which we did an adult living donor transplant in 50 patients, and 1 pediatric liver transplant, and 1 auto transplant in a patient who was having a normal liver with a large ACC involving the hepatic veins. So we removed his liver, and we removed that tumor, and then we reimplanted his liver back to his body. He's fine so far. So this is a brief demographic in which the majority of patients is more than 50 years of age group, 47.1, and with a male preponderance in our data, 76.5%. So most of the patients are coming from the Sindh, and they were basically related to the Sindhi speaking.